Action.
Hi, my name's Sybil, and today I'm going to be performing a head, ear, eyes, nose, and throat exam on our patient today. I'm going to first ask her some questions about her history to develop a baseline and see what problems she may already have, and then I'm going to do a all-over exam to see if she has any infection or any problems with her head, eyes, ears, nose, or throat. Okay. Hello, how are you doing today?
Hi.
Good. Okay. I'm just going to ask you some questions real quick. Have you had any history of headaches,
No.
seizures,
No.
migraines,
No.
nothing like that? Okay. And any history of head injury?
No.
Okay. Surgery?
No.
Okay. How about your ears? Have you had your hearing tested regularly?
Well, no. Once in a while. No.
Right. No history of hearing loss?
No.
Okay. Any history of ear infection?
No.
Okay. And your eyes, do you have your vision checked regularly?
Yes.
So you're wearing glasses?
Mhm.
Okay. And any history of eye trauma or surgery? Okay. And for your nose, any history problems with your nose or
No.
any history of trauma? Okay. And same with your throat, any history of sore throats, severe sore
No,
throat?
not severe.
Surgery? No. Okay. All right, now I'm going to begin the examination part. And I am going to first look at her head. I see that it is upright and I don't notice, and it's symmetrical. No tremors or tics are noted. I'm going to, if you don't mind, I've washed my hands already, and I'm going to inspect your head, and I'm feeling for any lumps, masses, and tender spots. And it's symmetrical, normal shape. I'm going to inspect the scalp for any redness, lesions, or tenderness, and the distribution of the hair, and I see that that is normal, and the hair is of a normal texture, and no redness or lumps or masses are noted. Could you take your glasses off for just a moment? Okay. And then I'm going to palpate for her the TMJ, temporomandibular joint. Could I ask you to just open and close your mouth? Very good. Okay, it's smooth, a little bit of clicking, but no crepitus and no pain with that, right? No pain
No.
when you do that? Okay. And I'm going to palpate the frontal sinuses here. Any tenderness here?
No.
And how about then the maxillary sinuses? Any tenderness here? Okay, good. And I am going to also palpate while I'm here the salivary glands, the parotid glands on the sides, and I don't note any swelling here. And the maxillary glands under here, no swelling noted or tenderness. I'm looking at her neck, and I see that it is symmetrical, and the musculature is well developed, and there's no masses or lesions noted there. I'm going to look at her trachea here. If you could just put your head back a little bit. I note that it is midline and symmetrical. And I'm looking at her musculature in the back of the neck, and I note that that is symmetrical, and there's no lumps or masses noted. Okay, I'm going to inspect your thyroid gland. I'm going to come around to the back. I'm going to ask you to take a sip of water and hold it in your mouth for just a moment. Okay, and I'm going to displace the thyroid to one side with my left hand while I feel the right side of the thyroid. I'm going to ask you to swallow. And I note that it's smooth, and there's no nodules, no tenderness, no masses noted. I'm going to do the same thing to the other side. If you take another sip of water. And I'm going to displace it with my right hand and feel the left side. Go ahead and swallow. Very good. Okay. Thank you. And I'm going to ask you to just tilt your head back again. I'm just looking also at visualizing the thyroid and seeing that it's smooth. There's no enlargement and no tenderness, no redness. Okay. I'm also on here. I'm going to feel for the carotid arteries, one side at a time. I'm just going to feel the pulse there, and it's like a +2. It's no thrills are noted. I'm going to do the other side as well. And that also feels normal, about a +2, no thrills. I am going to just auscultate the arteries there. Here. And I'm going to listen for bruits on the carotid artery. And no bruits are noted there or there. I'm also feeling up here the temporal arteries, and then I'm going to also take them from Bruy. Okay. For the eyes, I'm going to ask you to open your eyes, okay? And we're going to put your glasses back on while we do your vision test. And I just note that her eyes are symmetrical and all her facial features are symmetrical. Then there's no redness or swelling or noted anywhere there. So I'm going to ask you to hold this up to your right eye, and we're going to read the Snellen chart on the wall, which is 20 feet from the patient. And we're just going to note that she reads the first 6 lines with her right eye, and that's fine. Okay, we're just going to pretend, and we're going to flip it over to the other side, and she's going to read the Snellen chart, and we note that she reads the first 8 lines of that, and she has a 20/20 vision in that eye, 20/30 vision in the other eye. Okay, now we're going to test your peripheral vision. So I'm going to ask you to hold this up to your right eye. I'm going to hold it up to the opposite eye on my side. I'm going to ask you to look straight at my eye, okay? And when do you tell me when you see my fingers moving? Okay.
Now.
Okay.
Now.
Okay, we're going to do the same thing on the other side, and
Now.
we're going to look. This is testing her peripheral
No.
vision.
Now.
Okay, and I note that it is this. She has no deficits to her peripheral vision. I am also then looking at her eyebrows. I note that they are normal. They extend to the outer edge of the eye. They're symmetrical. And I'm going to ask you to take your eyeglasses off again. And I'm looking at her eyelids. I don't notice any swelling, any lumps or nodules. Eyelashes are intact, no redness, no discharge from the eyes. I'm just going to ask you to look up. I'm going to just pull this away. I'm looking at the conjunctiva. It's pink and moist. Her sclera is white, and no discharge noted. I'm just going to palpate here the eyes, the lacrimal gland here. No tenderness, right? Any
No.
tenderness there? Okay. And on this side the same.
No.
Okay. Very good. I'm going to look in your pupils with my little light. I'm just going to ask you to look straight ahead at my nose while I shine a light in your eyes. Very good. And I'm noting that her pupils are round, equal round, reactive to light, and okay. And then I'm going to ask you to, I'm going to test her 6 cardinal fields of gaze. If you can follow my finger, just with your eyes and not with your head. Very good. I'm just going to hold her head still so that it doesn't move. Very good. And on the other side, the same. Just look straight at my finger. Very good. Okay. With the ophthalmoscope, which I don't have, we're going to pretend that this is an ophthalmoscope. I'm going to visualize the structures of her retina. I'm going to hold the ophthalmoscope up to my eye. I'm going to look for the red reflex in her pupil, and I'm going to follow it in carefully. I'm visualizing the fundus of her eye. I see the optic disc. I see that the fundus is like a creamy orange color. I see the blood vessels, and they look all normal. No tortuosity or any abnormalities noted. I'm going to do the same thing to the other eye, following the red reflex in, and again I see the same on that eye. Okay, and then next we're going to look at your ears, and I am going to note that the ears are symmetrical, of normal size and normal position. No masses or lumps are noted. I'm going to look in her auditory canal with the ophthalmoscope, of the otoscope, excuse me, and I'm going to look inside. Okay, and I note that there's no redness, discharge, swelling. I can see her tympanic membrane. It's pearly gray in color, and I note the structures of the tympanic membrane. I'm going to look on this side as well. Okay, and I can visualize the umbo and the structures of the tympanic membrane, there's no bulging or redness noted. Okay, next we're going to perform some hearing tests, and I'm going to, again, pretend that this is a tuning fork. I'm going to place the tuning fork on your head. I'm going to ask you to, can you hear
Yes.
the sound? Do you hear it in one ear or both
Both,
ears?
both.
Both ears. Okay, very good. We're going to hit the tuning fork. I'm going to hold it to her mastoid bone in the back behind her ear, and I'm going to ask you to tell me when you stop hearing the sound. Okay, and then I'm going to hold it in front of her ear and tell me again when you stop hearing the sound.
No.
Okay, I'm going to do the same thing to the other side, and I note that her hearing through the air and bone are roughly equal. I'm also going to perform the whisper test, just kind of a rough test of her hearing. I'm going to close the one ear, and then I'm going to whisper on this side. Tell me if you repeat this word for me, please. Apple.
Apple.
Okay. And baseball.
Baseball.
Very good. Okay. I'm going to look at her nose. I'm noting that it is symmetrical. There's no discharge. Again, I'm going to just look inside real quick. And I'm looking up and I see that the mucosa is pink and moist, and there's no discharge. The septum is midline, and that all looks good. The nares are patent. I'm going to look in your mouth, and okay, if you could stick out your tongue. Very good. I notice that it's symmetrical and it's midline, no deviation to the one side or the other. I'm going to look inside at your teeth, and open again and stick out your tongue. And I'm noting that the buccal mucosa is pink and moist, the uvula is midline, tonsils are not enlarged, and teeth are good. There are a few missing teeth, few filled cavities, and but the gums look nice, pink, moist, firm, no lesions noted, and no redness or swelling. The last thing I'm going to do is the gag reflex. I don't have a little tongue blade. If I did, they're going to ask you to, again, I would poke it down in the back, and then I see that her gag reflex is present. And that concludes our examination of the head, eyes, ears, nose, and throat. Thank you.